is Elizabeth Haun. I'm a registered nurse at the Rural Health Clinic.
Oh, hold on. You can just talk to whoever's there.
Hi, everybody. I've been told to start over, so. Okay. Hi, everybody. My name is Elizabeth Haun. I'm a registered nurse at the Rural Health Clinic. I've probably talked to you on the phone a few times, and I'm here with Lindsey Hughes, who you will see in a few minutes after I finish my portion of the talk. I think are we going to wait a few minutes for more people or just plunge ahead?
I think you're good to go.
Okay, I'll just plunge ahead. So let's see, let's get this first slide up. Somehow. Okay, there we go. So we're going to be talking about lifestyle management, which is what Lindsey will talk about when I'm finished, and then I'll go forward here with the diabetes facts. So diabetes, as you probably know, is associated with many comorbidities or other diseases like hypoglycemia, which is low blood sugar, high blood pressure, coronary disease, heart disease, stroke, blindness, kidney disease, and amputations. It also is related to lots of medical costs and reduction in productivity. So $176 billion in direct medical costs and $69 billion in reduced productivity. That's a lot of money. There are two types of diabetes. Type 1 diabetes is what used to be called juvenile diabetes. It's an autoimmune disorder, and that means that your own body is destroying these cells in the pancreas that produce insulin, which you need to manage your blood sugar when you eat. So these cells are called beta cells in the pancreas, and they get destroyed. And so the onset typically is in children, teens, or young adults. That's usually when it's diagnosed, but it can come on later. It requires total dependence on insulin because your body's pancreas beta cells are no longer producing insulin. So you need to either self-inject or use a pump. Healthy diet and exercise is still an important part of prevention for the comorbidities that were listed before. Somebody who has type 1 diabetes, their overall life expectancy is 13 years less than the average person. We're going to focus mostly on type 2 diabetes, but first I have a question. I'd like people to participate if they like, either by Zoom chat or in YouTube. You can type in your responses. And I just wanted to know what you think of why would a healthy diet and exercise be important for the prevention of comorbidities if you have diabetes, such as high blood pressure, high cholesterol, heart disease. So is it A, loss of muscle mass, B, worsening lab values, C, stop the progression of the disease, or D, put you at higher risk of diabetes? Anybody? Okay, moving on. Do we get any responses?
Yeah.
We did?
What did you get?
Oh, okay, C, oh, I see. C, and one. And one, I'm just copying everyone else. Okay, good. Yeah, C, so stop the progression of the disease. And also what's important here to have a healthy diet and exercise, because you would need to take less medication. Medication, as we know, all medications have side effects. And so the less medication you can take, the better for any kind of diseases. Okay, moving on. So type 2 diabetes, it's a chronic condition that affects the way you metabolize the sugar from your food. Most foods contain sugars, some more than others. And insulin is required to move those sugars into your cells so that you have the proper amount of energy that you need. So type 2 diabetes affects your body in two ways. One of them is the inability of cells in your body to recognize the insulin, and or you can have both conditions. The second one is that the beta cells that we talked about earlier in the pancreas do not produce enough insulin to maintain normal glucose levels. I call it pancreatic malaise. Your pancreas gets kind of tired. So an important statistic that I put here, which I'll explain a little bit later, is that once you get to the point of pre-diabetes, you've lost 70% of your beta cell function. So there's only 30% of your beta cells are producing insulin. So I just have this little slide here that shows, here, let's look at it closer. The reason why I put this in is it shows kind of how complicated the whole process is. If you look on the right, at my right, I'm not sure if it's your right, but there's the insulin molecule that you can see that's floating around. So the little molecules that you see of glucose and insulin, that's your bloodstream. And as these molecules float around as you eat, the glucose molecules increase in your bloodstream, which it stimulates the beta cells to produce insulin. And so the insulin will land in these receptors in your cell wall, which is like a key that will open the glucose gates. So the insulin lands in the receptor, those gates open, and the glucose slides through those tubes and down into the cell where it's needed. I just wanted to show you this little slide because it's quite a complicated process. I can explain it in a less complicated way, but there's a lot of stuff that's going on there in the cell for the glucose to drop down into the cell where it's needed. Okay. Okay, here's the video. I have this little video, just a quick thing that explains it probably a lot better than I do. I'm gonna have Scott set this up for me. Thank you, Scott. Here we go.
Understanding type 2 diabetes. Type 2 diabetes is a metabolic disorder that causes sugar in the form of glucose to accumulate in the blood rather than being used as fuel by the cells in our body. When we eat, food is broken down by our digestive system into nutrient molecules that are then absorbed through our digestive tract for use by the body. Foods containing carbohydrates or various sugars are broken down into glucose. Glucose is an important source of fuel for many organs in our body. However, to be able to use the glucose for fuel, the glucose molecule must first enter into the cell. The pancreas produces a hormone called insulin, a chemical messenger essential for the entry of glucose into cells. As the blood glucose levels rise after a meal, insulin is released into the bloodstream and sets processes in motion to trigger the removal of glucose from the blood to enter into the cell. In type 2 diabetes, the cells become resistant to insulin and ignore its message to absorb glucose. This is known as insulin resistance. In addition, in type 2 diabetes, the pancreas is unable to produce the greater amounts of insulin needed to trigger these resistant cells to take in glucose from the bloodstream. The most notable symptom of diabetes is frequent urination.
Okay, so moving on. Okay. So this is an example of someone a person with type 2 diabetes and a person without type 2 diabetes that has eaten a meal. As you can see on the bottom, the normal progression of the insulin glucose process is quite rapid. You have a spike and you eat something, you have a spike in your blood sugar that stimulates the insulin to be produced. The insulin comes out, opens that gate, the glucose moves into the cells, and your blood glucose drops within a couple of hours. And the top one, the green one, you can see if you have type 2 diabetes and that process isn't quite working as well as it should due to either the insulin resistance or the lack of insulin, it takes a lot longer for the blood sugar to disappear from the circulatory system. So these are the risk factors that put you at risk for getting diabetes. The first three are ones that are in our control, and then the last three are ones that are not necessarily in our control. So the first one is weight. Increased fatty tissue is likely to increase insulin resistance. The fat distribution is also, if you have increased weight, it's where the fat that you have, the extra fat you have is distributed. So abdominal obesity puts you at greater risk because of the pressure on the pancreas and other tissues used for carbohydrate metabolism. That also affects the liver. Inactivity, because exercise utilizes glucose for energy and increases your sensitivity to insulin, as well as many other things that exercise is good for that we all know about. The ones that we can't control is family history. You have increased risk of developing type 2 diabetes if a parent or sibling has it already, or if both parents have it, it increases even more. Also race, people of Hispanic origin, American Indians, Pacific Islanders, and African American individuals are also more likely to develop type 2 diabetes. Age is also another one. We all, as we get older, we all have a higher risk of developing type 2 diabetes after age 45. So here are, let me look at this closer. Here are the signs and symptoms of diabetes. The hyperglycemia, that's when you have too much blood sugar in your bloodstream. It's dry mouth and thirst, hunger, mild headache, frequent urination, weakness, and sleepiness. So mostly what people hear about is you have to drink a lot and you have to urinate a lot. Even though diabetes is often results in high blood sugar, you can also have episodes of hypoglycemia or low blood sugar, especially if you are diabetic and are on medications already. And those symptoms are sweating and pallor, irritability, severe headache, low urination, blurred vision, and fast heartbeat. So this is the basic diagnostic criteria for pre-diabetes and type 2 diabetes. So when you go in to have your blood drawn and you're fasting, your glucose measurement should be lower than 100. So as you can see here, if you have pre-diabetes, it's 100 to 125. If you have diabetes, it's over 126. This second one is called a glucose tolerance test. It's where you drink this kind of yucky, syrupy, sweet stuff that's really horrible, and then they test your blood glucose after 2 hours. So going back to that graph that we saw earlier, let's see if I can pull this off. Here it is. If you have normal blood glucose 2 hours after you drank that syrupy, gross stuff, your blood sugar would drop to a more normal level, whereas if you have type 2 diabetes, it would stay high. Okay, here we go. Okay, so the other one is the A1C, which is an average of your blood sugar over a period of 3 months. And that should be below 5.7, 5.6 and below for for normal. Pre-diabetes is in the 5.7 to 6.4 range. And then above that, 6.5 is in the diabetic range.
It looks like you got a question.
Oh, okay. Patients often ask, when should I go to the ER in reference to elevated blood glucose? When would you recommend someone go to the ER? Thank you, Denise, for that question. So when people have diabetes, they have certain tolerance for blood sugars. So some people with pre-diabetes or diabetes have a tolerance for higher blood sugars than other people do. And so often it depends on the symptoms. If you test your blood sugar and let's say your fasting blood sugar is at 300 or 400, but you tend to run high anyway, you may not be symptomatic and you may not have any problems. You can lower your blood sugar and get it under control without any symptoms. If you are symptomatic, those symptoms that I went over, especially if you start to feel weak and sleepy, if you can't wake up, you can't, you have a hard time getting up and moving around, those are, and you know, severe headache, those are the ones, the symptoms that you really need to be aware of in terms of going to the hospital. So does that answer your question? You're welcome. Okay, so we're going to go a little bit into medical management. So blood sugar monitoring is done with a monitor where you prick your finger and you get the blood and you put it in this little machine and it tells you what your level is. Typically you can, depending on how well your blood sugar is controlled, you can test up to 4 times a day, or you can have random readings throughout the month. If you're very well controlled, you can maybe even go every 3 months and just have that A1C value blood drawn every 3 months if you have well-controlled diabetes. Oral medications, the options are, I'll show you some options coming up, but basically the medications can stimulate the pancreas to produce more insulin, or they inhibit the production and release of glucose from the liver into the bloodstream, or it can decrease the carbohydrate absorption. So the other option is insulin injections, and there are different kinds of insulins. There's long-acting insulins that you inject yourself with once a day, or there's short-acting insulins that you may have to inject 4 times a day with each meal. And then there's the kind of intermediate in between ones. And I do have an example of a slide here of, I'm going to bring this bigger. This is just bigger. It goes like that. No. Okay, there we go. And I can move this over, right? Okay, good. Oh, I'm doing so well. So this is just an example of, the point of this slide is to overwhelm you, because I just want to let you know that there's so many medications out there for diabetes nowadays for treatment. If one of them doesn't work, we try another one, we add this. And so it's fairly, it looks complicated and overwhelming, but it is fairly, there are many options for getting blood sugars under control. The ones on the left are the oral ones, pills that you take, and the ones on the right are insulins. So there's a lot of options, and this is something that you would work with your provider to get the right options for you. And they all do kind of different things. So it's just a matter of working together with your provider to get the right combination for you. So in summary, you know, we just went through the New Year's, and there are people who like to make resolutions regarding changing dietary habits. And some of these diets that people can go on can be very unpleasant and demoralizing. There really is no mystery of how to eat better, despite all the overwhelming and conflicting diets and dietary studies that are out there. Eating healthy has been remarkably consistent throughout decades, which is fewer processed foods, more vegetables, fruits, nuts, beans, whole grains, fish, and some meat. And the trick is to find a sustainable way to eat for you, a sustainable, healthy way that fits your lifestyle and your likes and desires. So I want to finish with this quote from Michael Pollan's book, In Defense of Food, that's pretty basic. It's eat food, not too much, mostly plants. At this point, I'm going to pass this on to Lindsey now, but I was wondering if anybody has any other questions. And we'll have another question and answer session at the end. So I'm going to pass this off to Lindsey Hughes.
Hello, hopefully you guys can hear me. Hi there, I'm Lindsey Hughes. I'm one of the clinical dietitians here at the hospital. I do a lot of inpatient and outpatient education. I do have a true passion for diabetes. So this is why I really wanted to put this healthy lifestyle talk together. You may have heard I'm also going to be doing a diabetes prevention program. And I'm going to talk about it at the end. So stay tuned and I'll give you more information on that. All right, so Elizabeth gave us a lot of great information on diabetes. It's really complicated, right? It can be overwhelming, and hopefully with some of the tips that we talk about today, it'll be less challenging for you. Is it easy? No, not always. Behavior change is really hard. So hopefully with these tips, we can manage it a little better and hopefully you can get off the medication or maybe never even get on it. So we're going to just talk about simple lifestyle modifications. Okay. All right. So main topics that I'm going to cover today, nutrition and physical activity. With those two, you can really manage your disease state and hopefully lose weight. So if you are overweight with good nutrition and good physical activity, and you can lose up to 5 to 7% of your body weight. That will significantly reduce your risk of getting diabetes. So some of the nutrition topics that I'm going to go over, portion control is a big one. We're going to talk about how we pair our carbohydrates properly. We're also going to talk about aiming for consistent intake of carbohydrates, because that's how we're going to regulate our blood sugars better. And with physical activity, we're going to talk about the newest guidelines that are out there. And we're just going to also have fun talking about all the stuff that we can do out here in the Eastern Sierra. So hopefully we can get interactive with that. All right, so nutrition, the big one. Like Elizabeth said, all these diets out there can be so complicated. And I can tell you, I'm not going to talk about fad diets. I'm not going to talk about the latest and greatest quick fix, because guess what? It doesn't work, right? Keeping it simple, getting back to the basics, well-balanced meal and physical activity. Let's just get moving. Simple, right? All right, so with nutrition, there's two main topics that I like to talk about with my patients. Portion control is the first one. Excuse me. I'm not going to be talking about water, but proper hydration is important too. So portion control. This is a big one. I like to use the plate method as a tool. It's just a really nice visual aid to put in place, so it helps you get well-balanced meals and also gets you all the right nutrients that you need. So I really like to teach using the hands as a measuring tool because they're proportionate to you. So my hand is going to be much smaller than my 6'4" fiance. So his needs are going to be a lot more different than mine. So when we're talking about the left side of the plate there, non-starchy vegetables. So there's a wide variety that we can have. It's really important to get that variety because all the color is where the nutrients are. So vitamins and minerals and phytonutrients. The reason why we do half the plate is not only for all the nutrients, but it also has less carbohydrates than starchy vegetables. Also too, if you fill up half your plate, you'll likely eat less of the starchy carbs and also the fat and the meat. So it'll give you more satisfaction so that you don't feel like you have to eat more of the other food items. Talking about the protein, you know, I encourage lean protein, especially for heart health. That's really important. That's a comorbidity of diabetes. We want to keep our heart healthy. So choosing lean meats or even plant-based proteins, tofu, tempeh, soybeans, those are all great sources of protein. And using your hand as a tool again, the palm of your hand is a really good visual aid. Again, my hand is much smaller than someone who is, you know, 6'5" or taller. Moving on to the carbs. This is the really most important section of the plate when we're talking about diabetes management. These foods in particular raise your blood sugars the most. So corn, bread, tortillas, fruit, pasta, potatoes, all of those foods really impact your blood sugar level. So it's really important to make sure that you make that a smaller portion on your plate. Okay. Do I have any questions? All right, check the phone. Trying to get out of this, hold on. There we go. Okay. All right, so we just talked about carbohydrates and how we want to limit them, but I want to go into more detail of the different types of carbohydrates. So we've got simple and complex. So simple carbohydrates, they digest a lot faster because they don't have as much fiber, they don't have as much whole grains. So these are the types of foods that we really want to limit the most because they really hijack your blood sugar. So sugar sweetened beverages, candy, baked goods, refined carbohydrates that you see in processed foods, all these things we really want to have small portions, if not at all. Complex carbs, these are all whole grains, you know, foods that have a lot of fiber like oatmeal or legumes. These types of carbs are really important to implement. The more fiber a carbohydrate has, it also slows down the digestion. So the next topic I want to talk about is pairing your carbohydrates. So a lot of my patients actually find that they haven't heard this before. So when you have a carbohydrate, it is really important to pair it with a protein or a fat. So carbs, they actually start chemically breaking down in our mouth. And so by the time they hit our stomach, they're already breaking it up into finer sugars, and it's going to hit your bloodstream even faster. So when you pair it with a protein or fat, those items, they digest slower on our stomach. So when you pair them, that carbohydrate digests a lot slower, and your blood sugars aren't going to be as impacted. So really important to pair. So examples, cottage cheese and fruit, apples and peanut butter, whole grain crackers and cheese. You can see the potatoes there with a piece of chicken, Greek yogurt and fruit. There's lots of different combinations that really work well together. Okay, so now we're going to move on to physical activity. So these are the latest guidelines and recommendations for getting adequate exercise. So it's recommended that we have at least 150 minutes per week of aerobic activity and at least 2 days a week of muscle strengthening. So you've got some pictures there of different activities. Of course, we live in the outdoor Mecca, so there's lots of options for getting active out here. So we've got aerobic activity, so walking, running, swimming, dancing, biking, hiking, tennis. You know, all these types of exercise, they really help regulate blood sugars. They also improve our cardiac conditioning, and they also really help with weight management. Muscle strengthening. So lifting weights or using resistance bands, calisthenics, we've got push-ups, sit-ups, squats, climbing stairs, that actually, develops our muscles. Even gardening, if you're doing heavy digging, that could be considered a nice muscle strengthening activity. Yoga, even though it's more stretching, it really does develop muscle well. So muscle strengthening exercises, they really help maintain the ability to perform everyday tasks, and they do slow down the rate of bone and muscle loss as we age. So I want to hear from you guys. What do you like to do as far as exercise? We live in a really amazing and incredible place. Obviously, we have a lot of outdoor activity, but there's also indoor. While you're putting your answers in, I'll share a few of mine. I love to mountain bike when the weather's great. I love paddleboarding, especially on the Owens. Ice skating, yeah, that's been a recent one this season. It's been a really great season. I like to rock climb a little bit. I love to dance. So Zumba is one of my favorite things to do. And I actually found a really new fun activity, and it's my favorite thing recently, and it's pickleball. I don't know if anyone's familiar with that, but it's a combination of tennis and ping pong. And you can actually play at Bishop Park out here. They even have a league, and I think it's Monday, Wednesdays, and Saturdays at 10. It's really fun. It gets the heart rate going. It's probably actually developed some good muscles too. I encourage you to try new things and get out there. All right, I'm gonna look at the comments here. So we've got walking, it's great. Paddleboarding, horseback riding, that's great, love that. Pushing my husband around. Love that. Oh my goodness. Hiking, stretching, yeah, those are all great. Pushing my husband around. That cracks me up.
Before you.
Okay, there's a question.
Is it important to do both of these? I don't like them.
Is it important to do both of these? I don't like running. It is important to do both because the aerobic activity really gets our blood flowing, gets our heart in better shape, whereas the muscle strengthening also builds our muscles, but also builds our bone health. So there are different types of exercises that we need to really get a better picture of overall physical health. I wanted to mention too, if you feel like you're deconditioned or you don't feel strong enough to do a lot of these exercises, we have a fantastic therapy department. You can get stronger with flexibility, mobility. They have different exercises that they can help you with. And all you would need to do is just get a referral from your physician. So if you feel overwhelmed by starting and don't feel strong enough, I would encourage you to start there and maybe see a physical therapist or occupational therapist. All right. So as I mentioned earlier, I am going to be implementing a diabetes prevention program. And it's put on by the CDC. So this Prevent T2, it stands for Preventing Type 2, and this is the curriculum that they use. Okay. So what is DPP? All right, it is a year-long lifestyle change program, and it's been proven to lower your risk of type 2 diabetes by 58 to 71%. And it is evidence-based, scientifically proved, fantastic. It's been around for over 10 years. It's all over the nation. You can see it in almost every county. And so I'm really hoping that we can get a lot of participation in this county. So it's brand new to Inyo. So about the classes, so they're 1 hour each. The first 6 months we would meet every week. And then the second 6 months we would meet 1 to 2 times per month. So it is a year long and it's a commitment. And I know it sounds daunting, but when you really think about it, it's only 24 hours, just a full day in an entire span of a year, 24 hours to change your life. So I really hope that you consider it. It is overwhelming to think being committed for a year, but the studies have shown that it really, really works. Okay. So what are participant goals and what are they expected? So it is considered a weight loss program. So the weight loss goal would be 5 to 7% of your body weight, which actually isn't that much. Moderate exercise, so we'll be tracking your exercise every week. And of course, going with the guidelines, we want to try and aim for 150 minutes per week. Also, you don't have to attend every class. Of course, I would encourage that. But the requirement would be to at least make 9 out of the 16 sessions. I don't have it on my slides, but I wanted to mention it. I forgot to put it in there. It is covered by some insurances and also Medicare and Medi-Cal. So we will be going over the eligibility in just a second, but it is free of cost for those who do qualify. Okay, so why it works, all right, so it's year long. The length of program is really why it works. You know, it takes a long time to change our behaviors, right? It's not going to happen overnight. You know, slow progression, sustainable change, okay? So the reason why it's so long is because we want to make sure that we really develop those behaviors so that we can take it into the future and make it last. The group setting, it's a really incredibly safe environment. It lends to a lot of support. The group will actually be interacting a lot. I will be just facilitating, and the group members are really going to be doing a lot of the talking. So it's a great place to meet some friends and feel supported and not alone. The tracking. So the tracking, we're going to track the weight and track your physical activity. All of those are really important to see your progress, right? The topics that are covered, you know, it's going to be 24 classes. So there's going to be a lot of different things that we're going to talk about. Of course, nutrition, physical activity, stress management, weight reduction, disease management, so much more. So there's going to be pretty much everything you can think of when it comes to prevention of diabetes will be covered. Okay. So are you eligible? These are the requirements to be able to be covered for the program. So you have to be at least 18 years old. Overweight BMI, so 25 or greater. If you are Asian, it could be 22 or greater. No previous diagnosis of type 1 or type 2 diabetes. So this is a diabetes prevention program. So if you do have a diagnosis of diabetes already, unfortunately, you don't qualify. You cannot be pregnant. And these are the test results that will qualify you in the pre-diabetes range. And you have to have them within the last year. So if you don't know if you have them or not, reach out to your primary doctor and get those. And if you do have them, great. And also too, you can be previously diagnosed with gestational diabetes. So if you don't have pre-diabetes, but you have had gestational, you qualify. Okay. Oh, we have a question. Yes.
So is it for people who have diabetes and don't qualify, can they still come if they pay out of pocket?
Thank you. Meant to mention that. So if you don't qualify or if you have a diabetes diagnosis, there is a cash pay option. So it'll be $10 per class or it'll be $200 for the year. So that will be available to you if you really want to participate. And I actually encourage that because a lot of the information that we'll be covering would be the same if you had diabetes or pre-diabetes. So join us if you can. And this is how you can sign up. You can contact me directly. My email's up there, and that is also my direct line to the district. So please contact. I hope you join. It's going to be a lot of fun. And I'm really looking forward to it. Okay, so that concludes it. Thank you so much for tuning in. Do we have any questions from the group for either myself or Elizabeth before we sign off here?
over the
Someone asked, can someone who doesn't live in the area sign up? Yes, absolutely. We will be, it's all online. I meant to mention that. It's going to be via Zoom. So if you live out of the area, absolutely. That's what's great about doing it online. People, you can be across the states and join. So yes, it will be virtual. The hope is to do it in person. Obviously, given COVID times, we do need to do it online. But if we do it in person, I'll make sure to have a Zoom option so those who are not physically with us can participate as well. Okay, where can we access these PowerPoints? Yeah. It is going to be recorded, so you will be able to see the slides if you watch it again. I don't know if we'll have the slides available.
So just direct people to the chat, the email marketing.nih@nih.org. That's a little bit up in the chat, but we'll email everything.
Okay. If you didn't hear Scott, the email is in the chat box there. You can contact Barb directly. See, it's marketing@nih.org. Okay, there we go. Oh, and I also forgot to mention, for those of you who want some additional information, we've collected some recipes and also the plate method. I'm going to have that in the attachment. If you would like us to email you, please give us your email in the chat, and we'd like to send you some additional info. Okay. Anything else? Okay, I think that concludes it. Thank you so much. Have a lovely evening.